Well, hi everyone, and welcome to Fount, and welcome Dr. David Lilley. Thank you for collaborating with us, David. It's really an honour to be working with you. I've seen you obviously live give lectures and teach the homeopathic community, and you never fail to inspire people, and people always want to hear more. So when I, heard these audio lectures that you gave a while back, I thought it'd be brilliant to put them onto digital files and get them out to a much wider audience. So here we are. So we're about to launch online David's teachings, and we're going to look at self-help homeopathy, where David, you will take us on a very interesting journey into homeopathy, exploring its science, philosophy, romance, and mysteries. So, David, before we go deeper into what the course entails, I appreciate that you're very well known in the homeopathic community with homeopathic doctors and also lay homeopaths. But for our listeners who may be new to homeopathy, it'd be great if you could tell us about yourself and your inspiration for your life's work. I mean, it's been 56 years, I believe, that you've been a homeopath.
Yes, a long time now.
Wow.
Yes. And I must thank you for the inspiration to go ahead with this particular project, because these lectures that we're going to start off with, in any case, have lain fallow for so many years. There they've been in the archives, and I think it's a wonderful thought to bring them to the greater public. On what are they based? Well, they're based on 56 years of practice, 41 years of intense practice from my very beginnings in the homeopathic world, after having studied medicine and homeopathy. This all due to the example set by my father, who was a professional homeopath and also a wonderful spiritual healer. He had a particular gift. But it was a gift, as he said, that he could not transmit to his son, or in fact to anyone. It is something that one comes to through spiritual status. However, homeopathy has the capacity to touch the individual at soul level. And I was fortunate, it's part of one's destiny, that at 7 years of age, I became desperately ill. I had picked up bacterial meningitis, a deadly condition, and at that time, of course, antibiotics were in their infancy. Sulfonamides had been developed. It was just after the war, and that could have been a fatal condition. My father treated me. He was a man of great experience, great insight, and he had, of course, many years of experience behind him when I became ill. And he treated me exclusively with homeopathic remedies. I went into a coma. I was in a coma for 3 days. And I emerged from this without any blighting of the nervous system whatsoever. Possibly a slight weakening of the left upper eyelid was all that I was left with. And that only shows when I'm particularly tired. Otherwise, I was unscathed. Now, to come through something like that, and particularly, of course, my father's experience as a wonderful man in every possible way, made me wish, please, Father, I want to follow in your footsteps.
Amazing.
So it was, and I never deviated from that. All my aspirations to be I think it was a tram driver or possibly a pilot, something like that, was shelved. And I was exclusively aiming at becoming a doctor. And quite cleverly and with good forethought said to me, David, you must do orthodox medicine first. Then I will lay my knowledge before you and assist you to become a good homeopath.
Amazing.
Shortly after the war, we left England. I was born in Leeds, and my father had his practice in London. We came through the Blitz. And then post-war London, my father was invited out to South Africa from London to give lectures on homeopathy and on spiritual healing. And this he did in the entire area of Southern Africa. And of course, he fell in love with this beautiful country. the sunshine, and of course the fact that it was like a land of milk and honey after coupons and queuing in London for your restricted amenities. So in 1949 we immigrated, and I had my secondary schooling in South Africa, studied medicine in Pretoria, then came back to London, to the Royal London Homeopathic Hospital, to further my studies in homeopathy. And then also at the same time, they attended the London Osteopathic College to attain osteopathic knowledge, which is extremely helpful. It's almost like the physical arm of homeopathy.
Mm-hmm. Yeah.
When I came back from England, my father had laid on a practice for me. From his own practice, he had taken patients. The first day I walked into practice, I had 12 patients. Can you imagine? And that was the least number of patients I saw in the following 41 years. So it was an intense practice. And during that time, I can say your orthodox training remains absolutely essential. The ability to diagnose and to evaluate a case and know where homeopathy is applicable and where it is not, that is important. To know its limitations and to know its scope. So that I had. But over those 41 years, my use of orthodox chemical medicine was minimal. As I grew in experience, I could embrace greater and greater pathology, go into areas which I found were amenable to homeopathic therapy. And wonderful what one could do even in terminal cases where orthodox therapy was utterly essential. But nonetheless, you could restore a person's dignity. You could maintain their health during that transition period, assisting in so many different ways. From that, of course, became my desire that my patients should be independent as much as I could possibly make them. Very soon, I realized that mothers are interested in natural medicine. They're interested in understand. The more you can teach them about the remedies that you're prescribing, the more familiar they become with them, the more they can apply them for the everyday events that occur in family life, the domestic illnesses, the self-limiting conditions, the infections that one gets, and how, if one gets in quickly enough, you can avert a more serious problem. So we would give them a medicine chest, basic medical homeopathic remedies, say probably a range of 36 remedies, and with small notes on each of the remedies so that they knew what was to give for fever, for vomiting, for diarrhea, simple cases. And from this dawned the thought that this would be wonderful to give in lecture form. So when these lectures were started, they were mainly attended by mothers, and I stress mothers, some fathers, but mostly mothers from the practice. And then this grew through word of mouth into a considerable number of people, as you will pick up from listening to the tapes.
Wonderful. And this was in South Africa, so yeah, because you'll hear sometimes David breaks out into Afrikaans, which is
rather primitive, I'm afraid.
So David, how, because you were born into this homeopathic family, your father a professional homeopath, but also a spiritual healer, a very well-known one in England.
Yes.
How has that influenced your approach to healing and also into your teaching, would you say?
Well, coming from orthodox medicine into practice, one is immediately confronted by all the tonsillitis, ear infections, chest infections, all of those conditions. And it is really that group, of course, that we cover in the lectures.
Yeah.
Complaints that develop during childhood, the numerous infections which we get, and how these can be so easily treated homeopathically. So that was particularly the focus of my work. I was dealing with physical conditions. And in fact, that's where I literally cut my teeth and became familiar with my homeopathic remedies, and if I could say it, athletic on my homeopathic feet. Through this experience, of course, these remedies become embedded in one's mind. And you become more and more proficient as you go forward. But I was always interested in the reasons for being here, why we are on this physical planet, why we exist, and what this existence, the meaning of this existence is. And it is, of course, to develop our soul qualities, to live the life of a spiritual being, to evolve spiritually. And I realized that deviations from spirituality, deviations from basic trust, underlines the cause of disease. Disease comes from dissonance, loss of harmony with the creation. One steps out of that harmony into an ego type of life, and a life based upon ego perception, that which is for me rather than for us. Egotistical thinking, egotistical perceptions, leading, of course, to envy, jealousy, fear, lack of basic trust being the underlying factor in most disease conditions, in fact, in all disease conditions. And I realized that here in homeopathy, we have remedies which can act because of their non-molecular quality, their imponderability. They can penetrate to the deepest regions of the soul and bring about healing at a soul level. And this is what can be termed archetypal medicine or depth homeopathy. As the soul moves towards basic trust, so confidence builds up, fears fall away, anxieties, phobias fall away. What is the purpose of anger, jealousy, selfishness? These things, as they fall away, open up the body to a natural process of healing at the greatest depth possible. We find then that it's much easier to treat the physical ailments that do inevitably happen and occur. So it is the movement from purely physical homeopathy and clinical homeopathy into soul or depth homeopathy, and where the remedies take on archetypal meaning, which we introduce in the very first module, bringing in an understanding of reading a remedy in archetypal terms. Now, this is a great excitement for the audience. An affinity for a particular substance, a particular animal, a particular plant, that I'm actually living, for instance, the life of the warrior, shall we say, or the lover, or the magician, or the king, or the emperor. And to recognize that this is role-playing that enters into all our lives, and that when this is matched by a homeopathic remedy which resonates with who you are expressing, you bring about harmony. And from that harmony, based upon basic trust, a healing process takes place at the deepest level. That, I think, would be the greatest change that developed from those earlier years of practice. Eventually, I realized that the asthma, the migraine, the eczema was purely a synchronistic condition that brought the destiny of myself and the destiny of the patient together with an opportunity for soul healing.
Yeah, that's incredible.
That became really the focus, and remains now to this day, the focus of all my work and my writings.
Yeah,
to understand oneself fully, and to be able to impart that to the person you then consult. To enter into a deep friendship with your therapist, your homeopath, at the deepest level, and to bring about a change which is taking place at soul level. And this is reciprocal, Marek. It is a process which affects the patient, but it also affects the therapist. It's a healing of the patient and a healing of the physician.
Yeah, incredible. And that's why, David, homeopathy is so powerful, because it's multidimensional.
Absolutely. You're dealing with a multidimensional being.
Yeah.
In orthodox medicine, of course, we're very much taught mechanistic medicine. That part of medicine is essential. You've got to understand the mechanisms of the body. You've got to understand the chemistry of the body and understand whether these things need assistance. But this is purely the vehicle for an immortal soul that is on a spiritual journey. We term it the hero's journey, the journey towards transcendence. It's a sublimation process with overthrowing of egotistical focus and replacing it with soul focus, to see with the eyes of the soul rather than the eyes of the ego, and to respond to the challenges of life through the soul rather than the ego.
And God did, yeah.
And homeopathy, being imponderable, we take a substance and we render it into energy form through a process which is known as potentization. As one does so, you're moving the effect of that remedy, its power, its scope, from the physical into the intellectual, from the intellectual into the emotional, from the emotional into the spiritual.
Yeah.
And you're not manipulating a person in any sense chemically. You're simply bringing about resonance between an archetypal energy and the archetypal expression of the person's life. Bring the two into confluence and a healing process takes place.
Like cures like.
Yeah, like cures like. What a substance can cause,
yeah,
it can cure. It can only cure because it can cause. And that which it causes, it can cure.
Yeah, incredible. And what I've noticed as well, when you treat children, babies and children, it affects the whole family. The energy can change and healing can take place with the mother, the father, siblings.
It's wonderful in that homeopathy, in the clinical range that it has, is so very important for earning the right to practice it at soul level. So you earn that in the particular family. The family will come to you particularly, and especially in my earlier practice with children. The pediatric part of my practice was all important. And here we were dealing with the usual fevers, the usual teething problems, the nappy rashes. Think of all those self-limiting conditions, which it is wonderful to be able to teach the mother how, by natural herbal remedies, they're herbal remedies produced very often from herbs, but also from minerals and from animals. Animal secretions, for instance, but we use particularly the milk of various animals, which are very archetypal. Anyone can understand, if I speak of a man as a lion, they understand by that immediately. If we speak of a woman as a cat, that has a certain picture that emerges. Now, it is the matching of the archetype to the patient. In treating the children, you get quick results. You get very definite response. One of the first things you teach a mother is not to fear fever. To understand that fever is the response of the body to a viral or a bacterial challenge, and that by stepping up the temperature of the body is able to work more efficiently, produce more antibodies rapidly, and address the infection. The increased body temperature embarrasses the virus and the bacteria, slows their replication, renders them less powerful. And how foolish it is then to use antipyrexia drugs, as we do with aspirin and such substances, paracetamol, to bring temperature down artificially. You need to work with the fever, using remedies which actually bring out the full purpose of that fever, to accelerate antibody formation and to build up the resistance of the child. When they've done this a number of times, they realize this is a keyboard I can play upon. You're listening to music, I can play this music. And the mother so quickly picked up on the remedies that helped baby. and of course what helped Grandpa with his problems.
Yeah.
And from that then comes that faith in homeopathy and in the person who's using it, that one can start to address life at a deeper level. And it's then you switch into the soul mode of treatment.
Yes. And I mean, you talk about that because there's certain remedies you really focus on, and you'll call it the silica archetype, the calcarea carbonica archetype, the ferrum archetype. Could you just tell us a little bit more about that, David, the difference?
Well, if we take an example from present days, we have this awful war in the Ukraine. And we have in that war a particular individual who has brought it about. And that person shows certain archetypal traits. The archetypal traits which become apparent to anyone who has considered Putin is the aggressor, the brutal warmonger, the utterly egotistical individual, narcissistic, lacking all empathy. If he had been brought to me as a baby Putin, the homeopath will recognize certain characteristics in that child and in the child's upbringing and how the child expresses themselves, would recognize the makings of what we see today as a world problem. Treat the little Putin and you will not have the adult Putin threatening the world with calamity. This is the distorted warrior archetype. It is the dark warrior, not the noble warrior. Zelensky, he depicts the noble warrior, the person fighting for his family, the people. He is the lion of his country, the shield of his people. He represents them. So we see challenging one another, just as we had with Hitler and with Churchill. The same archetype in light form, noble form, and dark form. And both are covered by a remedy, fundamental remedy, ferrum, which is iron. The Iron Age is it's a patriarchal age. It is highly masculine. It is highly egotistical. It is grasping. It is egocentric. And yet, it's also the cavalry coming to the rescue of the besieged. It is both aspects, and they both fall under one single archetype, ferrum. There are others, of course, warrior types that we have, but looking very fundamentally here, Marek, ferrum is an excellent example of the warrior archetype. And we must understand always that for every Jesus, there will be a Judas. For the saint, there will be the sinner. The two are essential for one another, in fact.
Mm. Do you feel that this has come about though because it's kind of like we've not really addressed these energies in the past?
Often we cannot address these matters. We can address them, and we have done for a long, particularly since the time of Freud and Jung, and with psychological analysis, analytical psychology, psychoanalysis, these two methods. But then where are the tools with which we can work, which we can use whilst giving counseling, whilst giving therapy? You need a remedy to assist.
Yeah.
You will often hear, I'm in therapy. And you see the same person 10 years later, and I'm in therapy. It goes on. And despite the counseling, and undoubtedly the support that it gives, conclusion is not reached. Resolution is not reached. That which has been suppressed within us, and we all suppress. Yeah. We suppress that which we cannot deal with. We cannot process it. We cannot resolve it. Therefore, we suppress it. And we suppress it into what we term the shadow. Yeah. Into the shadow right from an early age. we lose our sense of immortality. A child has a mythical world in which it lives. It has an awareness of dimensions which you and I, at our age, and I'm speaking generally, have lost. We move away from it, we become pragmatic, we become involved in survival, bread on the table, roof over the head, and the mystery of life is lost. We recapture it on Netflix, temporarily, don't we? We look at it, it's not given to us, the violence is portrayed, but within us all, we know what a good romantic film is about. And some of them date way back, but they used to touch the heart, and you came out with that. That's a...
You've been fed.
Exactly.
You've been fed.
And this is what homeopathy gives. It moves one into that terrain. From the fears of this life is daunting. And when you lose trust in it, when you do not see its perfection, you've got to be able to look at whatever is happening in the moment that you're existing in and know it's perfect. The supreme consciousness is benign, benevolent, loving, nurturing, supporting, and is intimately aware of what you, the individual, are going through.
Yeah.
Homeopathy switches you into that sort of thinking. It brings out what has been suppressed. All that has been suppressed must come out. It must be voided. In regression therapy, we can achieve this to some degree. But what happens, of course, is that we go back into the past. Some people will even want to go back into past lives to find out, now, why have I these inborn fears and phobias? Where does it come from? How is it that from the first moment I existed, I had fear? I had lack of self-confidence. I had a sense of inferiority. Where does this come from?
Yeah.
Regression therapy, of course, touches things which are being forgotten, but it is not a process which resolves. Therefore, you will revisit the trauma in all its naked power, without the context in which it took place, and reinforce the experience that traumatized you, wounding again the child within you. Homeopathy is like a kettle that's boiling. It permits what the water that is contained, and here I'm just using an analogy, that which is suppressed in the shadow aspect of ourselves, what we have not realized about ourselves, our divinity, what we have unresolved, our emotions that we have not been able to cope with, very often emotions that are better forgotten. So awful are they? They just attract guilt and shame.
Yeah.
Things that we reject, things that we deny, things that we don't want about ourselves, the unwanted aspect. The beauty of homeopathy is that with these potencies, which are purely energy, not interfering chemistry, not forcing people this way and that way, but just creating a natural vent through which these repressed energies can realize themselves and dissipate like steam out of a kettle.
Well, David, I've experienced that because I'm lucky enough that you treat me and my family. So I've experienced that deep healing and how subtle these remedies are, how they will bring a dream out or
Awful they are.
Bring a symptom out into the body, actually, which is always, it's a good sign as well, isn't it? I mean, that's the other thing, is the suppression of skin disease with steroids and things, pushing it back into the system, and children then developing asthma. And
very, very true. You know, very quickly one treats a teacher. I stressed many men, of course, fall into this category as well, but the women particularly have a feeling for homeopathy.
Yeah,
it's very feminine medicine, as opposed to orthodox chemical medicine, which is very masculine.
Yeah,
very feminine. And women, they very soon, we teach them, and what you've just said is so important. The understanding that the body is always working at its optimal best. When it throws out something onto the surface, it is doing so for a very good reason. It is trying, in fact, as part of that process of expressing what has been repressed, is trying to bring out in the most harmless way the condition that the patient is suffering from. It is releasing it, it's establishing an external vent. One of the typical ones is the childhood eczema. That cradle cap, a little red flag saying, help me. Within that child, this is the first attempt of what we term the vital force, the animating force, which we all have. We're conscious of it. We know our biorhythms. Sometimes the vital force is on its toes. Sometimes it's flat. So we're conscious of this animating, vigorous energy that is perceiving, that has an instinctive intelligence, knows what is necessary to bring about health. Chemical medicine doesn't understand this. We see an eczema, what do we use? We will use some coal tar products for external if we're using very mild remedies, or we go so far as to use steroids. We are then imploding that energy just as we do when we suppress our anger. Tight-lipped, or our fear, thin-lipped. It's not there, it doesn't exist. I'm confident. But meanwhile, a different story is going on inside. And this is purely the physical part of what we've described on a soul level. And that implosion means that the disease, when it's suppressed, suppress an eczema, and you're looking at deeper allergies developing, possibly hay fever, possibly asthma. The one becomes the other. The more you suppress, the deeper the condition goes. Eventually, it starts touching the mind. It starts interfering with intellectual capacity, concentration, focus, and then goes on towards confidence. And then from there comes the anxieties and the fears. And when we fear, we become angry. And when we're angry and we can't cope with the anger, we become depressed. And so we see that pathological process of disease increase.
Yeah.
Homeopathy takes us back from depression into anger, anger into fear, the abnormal anxieties that we have, and then dissipating it in the most harmless, non-toxic, gentle manner.
Incredible. So yeah, David, so I mean the course is very extensive. It's if I can just share with people what people will learn. I mean, basically, they will learn how to self-medicate homeopathically for simple, self-limiting conditions experienced in daily life, as you said. You look in depth into the laws of homeopathy, its history, development of disease, which you touched on, the cosmic creation of homeopathic remedies. You look at first aid, tissue salts, fever conditions, gastritis, remedies for the eyes, common colds and flu, emotional states and behavioral problems such as school phobias, anticipatory fears. You also look at shock and trauma, depression and grief, pregnancy and childbirth. And so, ladies and gentlemen, there's over 24 hours of inspiring knowledge of content. And David, you cover you probably cover more actually, but 117 remedies in that time.
I've never counted them.
Yeah, I did. I think I might have missed some, but yeah. So it's an incredible course. And so, David, who do you think this can really help? Is it mainly like mothers, like you said? And
yes. It is wonderful, and those who listen to the course will pick up on how the mothers learned. I'm often asking questions from the floor.
Yeah.
And they will soon pick up that these mothers are learning and are able to answer intelligently and have an understanding. That I find it far more rewarding to lecture to the laity, rather than to my peers. It is amazing how people grasp the archetypal principle and how interested and enthused they are by gaining archetypal knowledge to start thinking symbolically. In our depths, we function on a symbolic level. In the language of myth, we dream myth. We dream parables. And life unfolds in a mythical form. The real reality behind the harsh facts is mythical. Yeah. It is what it seems. When we see tragedy, we're looking at it through the eyes of the ego. When we register tragedy, when we look at it and interpret it and understand it in a broader sense with basic trust that all is well, that every moment, every instant is sacred. And in being sacred, it is perfect. It's perfectly orchestrated, choreographed for the transcendence of the ego into the soul, and the soul into the spirit. This is not a religious concept. It is a psychological fact that one is developing in this particular way, and that life is constantly couched in terms that will facilitate this, that will stimulate it. Very often it's only a great shock, a great trauma that makes me start to think about, what is this about? Why am I here? Who am I? That's a rather important aspect with homeopathy, learning the answer to that question. Who am I?
Yeah.
So through the lectures, of course, you're speaking about archetypes, and the mothers are thinking, oh, that's Uncle So-and-so. I know.
Quick, give him the remedy.
Yes. And in actual fact, you're in the laity becoming involved in this way. They make their homeopathic support system so much more efficient. The homeopath's work is half done.
Yes. Yes.
It is still good. They should have a professional beside them to assist them. But to be able to deal with the little problems that arise in life, and particularly the self-limiting conditions which we're all exposed to, from an ingrowing toenail, for instance, which can be happily treated if you know what remedies to give, a boil, a pimple, acne, all of these things are well within the scope. And from learning how it works, you gain a feeling for potency medicine, medicine in energy form, energy medicine, holistic medicine, medicine that treats the entire being, the multi-dimensional being that we are at all levels.
Yeah. And
from this, of course, this knowledge, the benefit that it comes is that you're speaking the same language. Patient and physician, these poles disappear. You become friends.
Yes.
You become partners in a mutual journey together. It's a shared interest and a shared commitment and a shared participation.
Yeah, it's wonderful, wonderful. Well, I hope that this course will inspire, people to go and visit a homeopath and see. I remember going for, with my daughter. She had nappy rash, and I came from a very biomedical background, and the questions the homeopath was asking about my daughter and her pregnancy, the labour, the birth, and then the symptoms of the nappy rash, which just blew me away. And then how sulfur, just changed it all within 24 hours. I mean, the thing that we did wrong though, David, we because we used to, we kept giving it. It's working. Oh, it's working. And then it actually got worse. So it's knowing when to stop. As soon as it starts getting better, you stop.
The big factor is to know that there are professionals out there to help you.
Yeah.
There is a certain area, a scope that one has with domestic homeopathy. And that should encourage one then to seek professional help and to have a professional homeopath beside you to take you into that deeper realm. You cannot treat yourself. You cannot treat yourself at that level.
Yeah.
That is what I would like this course to be, an introduction to the domestic aspects, but leading you to take that extra step further, to understanding that here is a medicinal, a therapeutic system which can be your friend through thick and thin, through fire and flood, assist you with all the problems that we are naturally faced with and make it that much easier.
Yes. And
And
yeah.
a simple example, you just passed a comment on it, examination funk or interview funk. I'm going to go for a very important interview. That, your knees are weak, your hands are shaking. Is there not something that I can take that is not an anxiolytic, that is not a drug which dulls your ability to think whilst calming you down artificially, but something that can actually give you chutzpah, that courage?
Yeah.
And that is, we think here of Gelsemi Menargentum Nitricum.
There's my Argentum Nitricum.
You had it on?
For today's.
Well, that was fit.
Yeah. So it helps immensely. Oh, David. Yeah, so what we're doing, we're giving the first module away for free, so people can get a feel of your wonderful teaching. And then we've got, basically, there's a total of 5 modules, with over 24 hours of content. So we'd love to hear the feedback from you when you start the course. And hopefully it'll inspire you to get your own homeopathic kit, to empower you to treat those minor ailments and then go on your amazing soul healing journey with a homeopath, with one of your local homeopaths. I think that would be just incredible that the course. Sorry, David.
That's first prize.
Yes. So wonderful, David. Well, thank you. Is there any final comments, David, you'd like to say as we finish off? I mean, you said some incredible things.
I think the most important thing I can say here, sitting here at 82 years of age,
yes,
I've not had an antibiotic in my entire life. I've been supported to have had homeopathy from childhood to this present moment. It has never failed me. I have failed homeopathy, most certainly. That you can expect. You're not always going to know the right remedy. You're not always going to be absolutely right every time. But homeopathy has never failed me.
Wow.
It's a wonderful friend to have, as I said, through thick and thin. Yes, that would be the last thing I say. Befriend homeopathy and you've got a friend for life.
Oh, beautiful, David. Well, I'm honoured to be your friend, and thank you for all your help. And we're really looking forward to the feedback from people on this course, and seeing how we can maybe take it forward.
Absolutely. Yes.
But homeopathy, it has that timeless element to it as well. So I know you recorded this, 20 years ago, maybe, was it? Or
a long time ago. Fully 20 years ago.
Yeah, incredible. But it's timeless knowledge that you did.
It's as valid today as it was when those lectures were delivered.
Yeah, wonderful. So I hope you'll enjoy it, and thank you everyone for listening, and thank you, Dave, for all your time. It's been an amazing to talk to you, and I'm so glad you went into the depth of homeopathy.